Allergies and viruses such as the cold, flu, and COVID consist of similar symptoms.
And this morning, Dr. Christopher Campos with Kelsey-Seybold Clinic joins us to tell us how we can decipher between them. Good morning, and thank you for joining us.
Good morning, Melissa and Jose. How are you all doing today?
We're doing great, thank you. Now, how do you know if you're dealing with allergies or a virus like a cold or a flu?
Yeah, so those are three kind of different things. The latter two are viruses, especially the common cold and the flu. And the first is the allergies. So we can start off with allergies really quick. So allergies are either, short or they can be perennial, right? So it means they can be just short kind of exacerbations, or they can last kind of year long. Some of the symptoms for allergies and common cold are similar. And in terms of all that, in terms of the allergies, you get the runny eyes, you get the sneezing, and with the common cold, sometimes that can be with similar symptoms, but with a cough.
Now, when I think about the flu, I instantly think, oh, body aches and a fever, and you just don't even want to get out of bed. And that's really not the case with the others, right?
No, exactly. So that's the next thing I was going to get to. In terms of allergies and common cold, they present very similarly, except for the common cold having a little bit of a scratchy throat. And the flu is very severe, right? So that you can even get up to, pneumonia and other complications with the flu. So it's very important to get the vaccination for it.
There are a lot of over-the-counter medications that you can take to take care of a common cold, basically. But when do you determine that it's time to go see a doctor, and what are the testing options?
Yeah, so in terms of the cold versus allergies, as I was saying, you usually have it kind of year-long, or you have a history of it. So that's how we as physicians kind of tell whether you have a common cold, because it can just be kind of sporadic, or maybe it's that time of the year, as in terms of the kind of the winter months. In terms of the common cold and the complications from it, you can get something called rhinosinusitis, which is can be an infection of the sinuses and even infections of the inner ear. Once you start getting severe pain or even mild pain after around the 7 to 14 day period, which before that it should kind of resolve by itself, that's when you should be like, okay, maybe I should be seeking a doctor, or even in the beginning, just to get that kind of enlightenment of what your condition is.
As far as allergies, how do you know when it's time to just go that next step from perhaps over the counter to maybe even some allergy drops or even shots?
I think when you have persistent symptoms or symptoms that affect your quality of life, such as you're at work and you really just can't do anything, or even at your personal kind of life at home, and these symptoms are really affecting your life, I think that's when you should seek out medical attention. And in terms of my job, in terms of internal medicine, we can take care of that, but sometimes we do refer to allergists to get those allergy shots and that specialized care in order for patients to get more treatment and longer relief.
Mm-hmm.
Great information. Thank you so very much, Dr. Christopher Campos with Kelsey-Seybold Clinic.
Thank you.